అందరికీ నమస్కారం. నా పేరు శారదా సింగిరెడ్డి. నేను బోర్డ్ ఆఫ్ ట్రస్టీగా ఆట సంస్థకు వ్యవహరిస్తున్నాను. 3 దశాబ్దాల క్రితం గొప్ప నాయకత్వంతో కూడిన వ్యక్తులతో ఈ సంస్థ ప్రారంభించబడి ఎన్నో సేవా కార్యక్రమాలు, అలాగే సాంస్కృతిక కార్యక్రమాలు చేస్తూ ముందుకు సాగుతుంది. 2022 జూలైలో 17వ కన్వెన్షన్ విజయవంతంగా జరుపుకొని ఈ మధ్య కాలంలో దసరా బతుకమ్మ సంబరాలు కూడా చాలా సిటీస్ లో ఆట నిర్వహించడం జరిగింది. అలాగే దసరా సాహిత్య వేదికను కూడా చాలా సక్సెస్ఫుల్ గా ఆట సంస్థ చేయడం జరిగింది. నిన్ననే అంటే శనివారం రోజున అట్లాంటాలో వాలీబాల్ అలాగే ర్యాలీలో 5K నిర్వహించి ఈ రోజు ఇంతటి చక్కటి హెల్త్ వెబినార్ ని మన కోసం ఆట సంస్థ ముందుకు తీసుకువచ్చింది. ఈ కార్యక్రమాలే కాకుండా ఆట చేపడుతున్నటువంటి కొన్ని కార్యక్రమాల గురించి ఈ రోజు ఇక్కడ మాట్లాడుకోవడం చాలా సబబు. మై స్కూల్ మై రెస్పాన్సిబిలిటీ ఆట ఫౌండేషన్ ద్వారా ఈ ప్రోగ్రామ్ NRS తో కలిసి ఆట సంస్థ చేస్తుంది. ఈ కార్యక్రమం అన్ని గవర్నమెంట్ స్కూల్స్ ఇన్ ద విలేజెస్ బోత్ తెలుగు స్టేట్స్ లో నిర్వహిస్తుంది. రీమోడలింగ్ స్కూల్ బిల్డింగ్స్, అలాగే లైబ్రరీస్ ని ప్రొవైడ్ చేయడం, అలాగే సైన్స్ ల్యాబ్స్ లో కావాల్సినటువంటి పరికరాలను ఇవ్వడం, అలాగే కంప్యూటర్స్, స్పోర్ట్స్ ఎక్విప్మెంట్, ఇలా ఎన్నో కార్యక్రమాలు చేస్తుంది విలేజెస్ లో ఉన్నటువంటి గవర్నమెంట్ స్కూల్స్ లో. ఇంకా డీటెయిల్స్ కావాలంటే మా వెబ్సైట్ అమెరికన్ తెలుగు అసోసియేషన్ .org ని వెబ్సైట్ ని సంప్రదించగలరు. అలాగే అమెరికాలో ఆట సేవా ఇస్ వన్ ఆఫ్ ద వింగ్ టు ప్రొవైడ్ ఎమర్జెన్సీ సర్వీసెస్ ద్వారా ఎలాంటి ఆపద వచ్చినా, ఎలాంటి గడ్డు సమస్యలు ఎదురైనా అండదండగా నిలబడుతుంది. తెలుగు వారికి మాత్రమే కాకుండా ఎవరికైనా తన చేయూతనిస్తుంది. ఈ మధ్య కాలంలో జరిగిన ఫ్లోరిడా హరికేన్స్ లో ఇప్పుడున్న పరిస్థితులను సహాయం చేయడానికి, అలాగే రాబోయే ఆపదలను దృష్టిలో పెట్టుకొని రెడ్ క్రాస్ ఆర్గనైజేషన్ తో అసోసియేట్ అయిన తొలి ఏకైక తెలుగు ఆర్గనైజేషన్ ఆట. ఈ ఆర్గనైజేషన్ ఒక తెలుగు వాళ్ళకి మాత్రమే కాదు, ఈ గడ్డ మీద విపత్తు సమయాలలో ఉన్నటువంటి ఎవరికైనా కూడా ఎలాంటి సమయంలో కూడా చేయూతనివ్వడానికి ముందుకు వస్తుంది. అలాగే యూత్ కొరకు SAT అండ్ ACT కోచింగ్ కంటిన్యూస్ గా నిర్వహించడం జరుగుతుంది. ఈ ట్రైనింగ్ ద్వారా ప్రతి ఏటా విద్యార్థులు తీసుకొని ఈ క్వాలిటీ ట్రైనింగ్ ద్వారా స్టూడెంట్స్ కి స్కోర్స్ ఇంప్రూవ్ అయినాయి. ఈ విషయం మాకు చాలా గర్వకారణమైన విషయం. అలాగే ఆట ఎంకరేజెస్ కాలేజ్ బోర్డ్ హై స్కూల్ సీనియర్స్ బై గివింగ్ స్కాలర్షిప్స్. ప్రతి సంవత్సరం వీరికి 10 స్కాలర్షిప్స్ సంస్థ అందజేస్తుంది. IT రంగంలో ఉద్యోగాల కొరకు ప్రయత్నించే వారికి లేటెస్ట్ IT టెక్నాలజీస్ లో ట్రైనింగ్ సంస్థ ఇస్తుంది. ఈ ట్రైనింగ్ ఇక్కడ ఉన్నటువంటి స్టూడెంట్స్ కి, ముఖ్యంగా MS చేస్తున్నటువంటి స్టూడెంట్స్ కి ఎంతో ఉపయోగకరమైనది. ఎందుకంటే వారు IT రంగంలో వారి యొక్క ప్రొఫెషన్ కంటిన్యూ చేయాలి కాబట్టి. అలాగే భగవద్గీత, యోగా, మెడిటేషన్ ప్రోగ్రామ్స్ వీకెండ్స్ ఆట సంస్థ కంటిన్యూ చేస్తుంది. ప్రధానంగా ఇక్కడ పుట్టి పెరుగుతున్న భారతీయుల కోసం మన మూలాలు మర్చిపోకుండా ఎన్నో సాంస్కృతిక కార్యక్రమాలు చేపట్టడమే కాకుండా బతుకమ్మ ఈ బుక్ మా సీనియర్ ఆట మెంబర్ అయినటువంటి డాక్టర్ ప్రభావతి చింతలారెడ్డి గారు రాశారు. ఆటా సంస్థ ఈ పుస్తకాన్ని పబ్లిష్ చేయడం జరిగింది. మొట్టమొదటిసారిగా బతుకమ్మ ఆటపాటల గురించి, బతుకమ్మ చరిత్ర గురించి తెలుగులో పబ్లిష్ చేసిన ఏకైక సంస్థ ఆట అని చెప్పుకోవడం చాలా గర్వకారణం. ఇక్కడ పుట్టి పెరిగిన పిల్లలకు ఈ గొప్ప సంస్కృతిని తెలుసుకొని ముందుకు తీసుకెళ్లాలనే ఆకాంక్షతో ఈ బుక్ పబ్లిష్ చేయడం జరిగింది. ఈ బుక్ అమెజాన్ ఇండియా, అమెజాన్ USA వెబ్సైట్స్ లో అవైలబుల్ ఉన్నాయి. అలాగే చివరిసారిగా ఆట మెంబర్షిప్ సభ్యత్వం లేని వారికి సభ్యత్వం తీసుకోవాల్సిందిగా ఆట సంస్థ ప్రోత్సహిస్తుంది. తద్వారా గొప్ప సహాయ కార్యక్రమాలు చేయవచ్చు. ఫర్ మోర్ డీటెయిల్స్ ఆట వెబ్సైట్ ని సంప్రదించగలరని మా మనవి. అలాగే ఇలా ఎన్నో సేవా కార్యక్రమాలు NRS తో కలిసి ఆట చేస్తూ ఎన్నో గొప్ప కార్యక్రమాలు చేస్తూ ముందుకు సాగిపోవడం అనేది చాలా గర్వకారణమైన విషయం. ఈ రోజు మన ముందర గౌతమ్ గోలి గారు ఉన్నారు. వారు ఆట బిగ్ టైమ్ సపోర్టర్, అలాగే డోనర్ కూడా. ఈ మధ్య 2022లో జరిగినటువంటి ఆట 17th కన్వెన్షన్ కి మాకు అడ్వైజర్ గా వ్యవహరించారు. వారిని సగోత్రంగా ఈ సభకి ఆహ్వానిస్తున్నాను. గౌతమ్ గోలి గారు, నమస్కారం.
థ్యాంక్ యూ శారదా సింగిరెడ్డి గారు. నమస్కారం అండి అందరికీ. నా పేరు గౌతమ్ గోలి. నేను ఆటా కన్వెన్షన్ అడ్వైజరీ 2022. రీసెంట్ కన్వెన్షన్ తెలుగు వాళ్ళందరూ కలిసి వాల్టర్ కన్వెన్షన్ సెంటర్లో ఒక అతిపెద్ద తెలుగు కన్వెన్షన్ చేయడము, ఇది తెలుగు వారందరికీ గర్వకారణము. ఇది ఆటా అమెరికా తెలుగు అసోసియేషన్ సంస్థ ద్వారా జరగడం అనేది గొప్ప విశేషము. సో ఆటాకి మరియు అందరికి విచ్చేసిన తెలుగు వారందరికీ ప్రపంచవ్యాప్తంగా అందరికీ శుభాకాంక్షలు. ఇది గొప్ప సెలబ్రేట్ చేసుకోవాల్సిన సందర్భం అది. ఈ సందర్భంగా మనకి ఆట ముందుకొచ్చి ఈ వెబినార్ కండక్ట్ చేయడము, దీనివల్ల లబ్ధిదారులకి చాలా ఉపయోగపడే విషయము. ఈ గ్లోబల్ డాక్టర్స్ వాళ్ళు ముందుకు రావడము, ఈ గ్లోబల్ డాక్టర్స్ వాళ్ళు కన్వెన్షన్ స్పాన్సర్ చేయడమే కాకుండా ఇవాళ వెబినార్ చేయడానికి ముందుకు రావడము, దానికి డాక్టర్ శ్రీని గంగసాని గారు ఆధ్వర్యంలో మరికొంతమంది ఎమినెంట్ డాక్టర్స్తో వీరు స్టార్ట్ చేసిన ఈ గ్లోబల్ డాక్టర్స్ సేవలు గణనీయమైనవి. ఇవాళ ఈ వెబినార్ అనంతరం మీరందరూ ఈ సేవల గురించి తెలుసుకొని మీ పేరెంట్స్కి కానీ మీకు కానీ ఎలాంటి సూపర్ స్పెషాలిటీ ఒపీనియన్ కావాల్సి వచ్చినా అతి తక్కువ ధరలో మీకు అందుబాటులో ఉంటుంది. ఇది శ్రీని చేస్తున్న ఒక మహత్తరమైన కార్యక్రమం. దీనికి అందరము ఈ గ్లోబల్ డాక్టర్స్ని ఒక ఇంట్లో వాడే జండు బామ్ లాగానో, ఇంట్లో వాడే ఒక అతి కామన్ మెడికల్ దీనిలాగానో మీరు గుర్తుపెట్టుకొని ఏ అవసరం వచ్చినా ఈ గ్లోబల్ డాక్టర్స్ వెబ్సైట్ విజిట్ చేయడము గుర్తుపెట్టుకోండి. అండ్ డాక్టర్ శ్రీని గంగసాని గారు, వారి ఎమినెంట్ డాక్టర్స్ టీమ్, థ్యాంక్ యూ సో మచ్ అండి. మీరు ముందుకొచ్చి ఈ సంస్థను ప్రారంభించి మీరు తెలుగు వారికే కాదు అందరి ఇండియన్ అమెరికన్స్ కి కూడా మీరు సేవలు అందిస్తున్నందుకు డాక్టర్ శ్రీని గంగసాని గారు అండ్ మీ టీమ్ కి ప్రత్యేక కృతజ్ఞతలు. ఇంకా ముందుకు వెళ్ళిపోయి తెలుసుకుందాం. ఇవాళ టాపిక్ చాలా ఇంపార్టెంట్ టాపిక్. మనం తరచుగా వింటున్నాము, చాలా మంది తెలుగు వాళ్ళు అమెరికన్స్ చిన్న వయసులోనే తెలియకుండానే సడన్ హార్ట్ అటాక్స్ రావడం ఏంటి, దాన్ని ఎలా మినిమైజ్ చేయడం అనేది ఇది చాలా అవసరమైన టాపిక్ మనందరికీ. ఇంకా ఎక్కువ సమయం చేయకుండా టాపిక్ లోకి వెళ్ళిపోయి విల్ లెర్న్ మోర్ ఫ్రమ్ శ్రీని. థ్యాంక్ యూ ఆటా అండ్ థ్యాంక్ యూ డాక్టర్ శ్రీని గంగసాని అండ్ టీమ్.
థ్యాంక్ యూ సో మచ్ గౌతమ్ గారు, చాలా చక్కగా చెప్పారు. ఈ రోజు జరగబోయే ప్రోగ్రాము చాలా ముఖ్యమైన ప్రోగ్రామ్. ఈ రోజు హెల్త్ వెబినార్. ఈ రోజు మన ముందు ఉన్నారు డాక్టర్ శ్రీని గంగసాని గారు. వారు గెస్ట్ స్పీకర్ ఈ రోజు. వారికి ముందుగా ఆటా సంస్థ తరపున ఈ వేదికపై ఉన్నందుకు శిరస్సు వంటి నమస్కరిస్తూ కృతజ్ఞతలు తెలియజేసుకుంటున్నాను. Dr. Srini Gangasani is founding partner of cardiovascular group in Metro Atlanta and practicing cardiology for over 20 years. He is the co-founder and chairman of board of directors of eGlobal Doctors Telehealth, which was instrumental in helping the patients during COVID pandemic. Antekakunda eGlobal Doctors is a corporate sponsor for our ఆటా 17th కన్వెన్షన్. దానికి మరొకసారి ఆటా తరఫున కృతజ్ఞతలు తెలియజేసుకుంటున్నాను. ఈరోజు టాపిక్ వై ఇండియన్స్ గెట్ మోర్ హార్ట్ అటాక్స్ అండ్ సడన్ కార్డియాక్ డెత్స్ అండ్ వాట్ టు డూ ద డిక్రీజ్ ద రిస్క్. అలాగే ఈ గ్లోబల్ డాక్టర్స్ గ్రూప్ కేవలం యుఎస్ఏలోనే కాదు, యూకే, యుఏఈ, ఆస్ట్రేలియాలో కూడా ఉంది. మరి ఈ గ్రూప్ లో మెంబర్షిప్ తీసుకోవాల్సిందిగా మా సభ్యులందరినీ కోరుతున్నాను. స్పెషల్గా మన ఇండియా నుండి వచ్చే పేరెంట్స్ కి అలాగే మనకి కూడా ఎంతో లాభదాయకమైనది. దీన్ని యూజ్ చేసుకుని లబ్ధి పొందగలరని అందరికీ మనవి చేస్తున్నాను. ఈ రోజు మనకి ఆర్య మోడరేటర్ గా రాబోతున్నారు. వారిని ఐ వెల్కమ్ ఆర్య టు కంటిన్యూ దిస్ ప్రోగ్రామ్. థ్యాంక్ యూ ఆర్య.
Thank you so much. Hello everyone, I'm Arya and welcome to the webinar. So before we begin with our topic, let me tell you, if you're looking for comprehensive and affordable health care by expert and trusted doctors from all over the world, eGlobal Doctors is the one-stop solution for all your healthcare concerns. We offer primary consultation, second medical opinion, multi-specialty consultations, and also follow-up calls. So you can register today at www.eglobaldoctors.com and book your appointment to address any of the health concerns you have. And also stay with us till the end to know about today's registration offer. Introducing Dr. Srini, he's the founding partner of Cardiovascular Group in Metro Atlanta, and he's been practicing cardiology for over 20 years now. He graduated from Kurnool Medical College of University of Health Sciences with multiple gold medals. He also did his residency and cardiology fellowship from William Berman Hospital and started his private practice in Atlanta, Georgia. He's board certified in cardiovascular medicine, echocardiography, nuclear cardiology, heart failure, and also transplantation. Dr. Srini has served as chair of American Indian Physicians Association Convention in 2019 and 2021. He was also chair of API Global Health Summit held in Hyderabad in 2019 and 20. He served as president and chair of board of trustees of Georgia Association of Physicians of Indian Origin, and he was elected as API board of trustees and served as vice chair of BOT. He's also the founder director of Georgia Association of Physicians from India Volunteer Clinic, serving uninsured Georgians since 2010, and he was appointed by the governor of Georgia to Georgia Composite Medical Board. As earlier mentioned, he's also the co-founder and chairman of Board of Directors of eGlobal Doctors Telehealth, which was instrumental in helping the patient during the COVID-19 pandemic. So welcome to the session, Dr. Srini. How are you today?
Good, Arya. Thank you. Yeah, good morning, everyone. I think I would like to thank ATA for giving me this opportunity. I think thank you for a nice introduction, Arya and Sharda Singh Reddy Garu. Thank you very much. First of all, I would like to thank the leadership team, Bonesh Garu, Madhu Garu, and Gautam, Anil Budreddy, and all the board of trustees who have done a wonderful job during the convention. Almost over 10,000 people at one place. It was amazing to see how great it was, and the hospitality was great, entertainment, and all the activities were superb. Thank you for doing a wonderful job, not only during the convention, but beyond, providing so many other resources for members as well as other Telugu community to provide different volleyball games or the other activities to keep them active all the time. I think as a cardiologist, I think I'm amazed that ATA can do so many physically active kind of activities to encourage the members. I think I would like to congratulate ATA and the team for doing a wonderful job. Today, I would like to talk about why heart attacks are more common in Indians. As you know, I think we see so many WhatsApp messages every day, every week, with all the Indians getting either a heart attack or having a stent or a bypass surgery or having a sudden death. I think I would just like to explain there are a lot of myths people, when they come to my office, that is it a heart pain or a non-heart pain, or why you get a cardiac arrest, or what is a sudden cardiac death. So I would like to share my screen so that I can just have a little presentation for about 15 to 20 minutes, and then followed by the questions so that you can have a live discussion about what. So let's talk about sudden death. What is sudden death? Sudden death is an unexpected death which happens within 1 hour of having a complication. So it could be cardiac, it could be non-cardiac. So in cardiology, what kind of cardiac causes can make people die suddenly? So the first and foremost is the arrhythmias. Arrhythmias is suddenly heart goes really too fast, like 200, 250, 300 beats per minute, which could be because of the heart attack, like a damage to the heart, or it could be mechanical complications like a rupture of either the heart or the aorta or some other causes. But these are the more common ones which can cause somebody to die suddenly without having any issues in the previous 2 hours, 3 hours before. But sometimes it could be non-cardiac. Not all sudden deaths are cardiac. So sometimes the neurological events like strokes, some ruptured blood vessel in the brain can cause somebody to die suddenly. Or sometimes the blood clots going into the lungs, that also can cause person to die suddenly. If there is a big blood clot, what we call a saddle embolus, which is a big blood clot, which happens in the legs and then travels to the heart, right side of the heart, and goes into the lung arteries, and which blocks the lung arteries so that people cannot get the blood flow going to the heart. So that is also one of the reasons for the sudden death. And there are other infections and some other causes because of that. People can die suddenly. But today's main topic, what I want to discuss is what is sudden cardiac death. The cardiac death is an unexpected sudden death due to a heart condition occurring within 1 hour of the symptom onset. So what kind of problems can cause sudden cardiac death? When you hear about somebody dying suddenly, just let's see how big of a problem that is. In America, 400,000 Americans die suddenly every year. So just look at a comparison, total COVID death in over last 2.5 years is 1.05 million, about 1 million. Breast cancer deaths are about 40,000 per year, 43,000 per year. So comparatively, heart attacks or sudden cardiac deaths occur 400,000 per year in Americans. So, but unfortunately, only 6% of them survive. Average age for these people who have a sudden death is 60. So when somebody has a sudden cardiac death at home or outside, the chance of their survival to the back to normal is 6%. That is very, very, very low. So that's where I think, I know in the past, Heart had done a wonderful job about the CPR and its awareness of CPR, which can make the person survive until the EMS arrives, or having the ability to shock somebody if you have a defibrillator in the nearby, like in outside in the malls. So those are the kind of things help people to get the survival rate go higher. Even in the hospital, when somebody has a cardiac arrest, the survival rate is about 40-45%. It's not 100%. So sometimes people have these complications, which are sometimes hard to get them back. So why people get the sudden cardiac death? So it could be the blockage problems, like the heart attacks. This is the main, I'm going to discuss more about it. Sometimes it could be a heart muscle problem. Sometimes it could be valve problem. Heart has, if you look at here, there are heart valves. So this is the blockages. These are the heart arteries. These arteries can get blockages, which makes the heart muscle not to get the blood supply, and suddenly heart goes into electrical problems, either the slow or fast heartbeat, which can make people's heart not to pump enough, so brain doesn't get enough blood flow. If our brain doesn't get enough blood flow for 5 minutes, it starts to die. So 4 to 5 seconds, you feel dizzy. So people faint after 5 seconds of not getting enough blood flow. And then after 5 minutes, brain starts to die. After 20 minutes, if the brain doesn't come back, people do not survive. So I think it's so important to do the CPR, learn to do the CPR so that we can have these people come back. So there are sometimes, because the blood pressure related, sometimes the cancer related, like even the heart can get the cancer, which you call angiosarcomas. Those kind of can cause some of the heart problems. So let's talk about what are the myths out there. A lot of people think, oh, I had a normal stress test, so my risk of heart attack is really low, or my risk of sudden death is low. Or I'm eating right, I'm exercising regularly, it eliminates the heart attack. Or I don't have any symptoms, so I do not have any blockages. So these are the kind of questions I would like to answer during my talk. So, and then second part of it is angiogram. My angiogram showed only 30% blockage or 40% blockage. My risk of heart attack is 0. So is that true? No. My calcium score is high. My risk of heart attack is very high. Or my stents and bypasses, I had a bypass, I had a stent. Is it going to decrease my risk of death? So these are the kind of questions at the end of it. I think you should be able to find the answers for after the talk. So what is a heart attack? So if you look at the heart attack is because of a blockage in one of the 3 heart arteries, which is going from either 20% to 80%, and then suddenly becomes 100%. So it's like a clogging of the artery in the heart, which goes from whatever it was, 20%, 30%, 80%, suddenly it becomes 100%. When there is a 100% blockage in the heart artery, it decreases the blood flow to that area. That's what causes the chest pain, difficulty of breathing. So those are the kind of things, especially if associated with the sweaty, nausea, those are the kind of things you need to take care of it sooner than later. So what are the possible etiologies? So it could be because of the chest pain. Just if you have somebody comes in with a chest pain into the heart, the hospital, so it could be angina, which is the heart not getting enough blood flow, or it could be a heart attack. Or there's a thing called dissection, where sometimes our aorta gets a division between the layers of the heart, the big pump, which is pumping through the blood vessel, which can get dissected. Sometimes you get the spasm of the arteries, pericarditis, and the heart failure. This also can cause the chest pain. Sometimes the chest pain can be other etiologies. It could be lung issue, asthma, pneumonia, or the lung pressure going higher can also cause the chest pain. Or sometimes it could be acid reflux. So acid coming into the chest can cause the pain. Or sometimes the muscle pulling in the chest wall muscles also can cause the chest pain. Not all the chest pains are the heart attacks. But if it is a heart attack, it's more severe. So if you're in doubt, I think you'll be better off going to the hospital or going to the doctor and have it checked rather than assuming that it's the muscle pain or the acid reflux pain and taking the Pepsid or Tums or something else. So nice to have it checked when you're in doubt that there is a chest pain, especially exertional chest pain. Always you'll be better off having the evaluation done by a physician. And if you're having a sweaty nausea with a chest pain, shortness of breath, you should go to the hospital. So classic anginal symptoms, what you need to be concerned about. If the pain is exertional, if it is in the middle of the chest, going into the left side of the arm or the jaw, or if it lasts more than 15 to 20 minutes, if it's the pressure, heaviness, or shortness of breath, these are the common symptoms you should think about getting to the hospital or the doctor. So which are the serious ones? As I think I've been talking about the sweating. So if you ever get symptoms like a chest pain and shortness of breath, if you're getting unusual sweating, nausea, I think it could be a sign of a heart attack. So you should go to the hospital rather than waiting for even going to the doctor. If somebody has a heart attack already, if they know what their symptom was at the time of their heart attack, I think most of the time the symptom is similar in that person. So if you get the same symptoms like what somebody had when he had a heart attack or when they had a bypass surgery, I think that is the time to get an evaluation done. It could be different for different people. I have patients who get shoulder pain alone, had a heart attacks. I had a jaw pain alone, had a heart attack. But typical symptom is the tightness, pressure, heaviness in the middle of the chest, going into the arm. That is the most common symptom. But when it comes to women, women have somewhat atypical symptoms. So they may just have fatigue, more shortness of breath, more arm pain, more heartburn-like sensation, or sometimes just the palpitation. So these symptoms are a little bit atypical for women. So, but anything with exertion or any of these symptoms consistently happening with exertion, I think women also should have the evaluation done. Just one sentence about the women and the heart disease. Women have a 10-year protection compared to men, but women can develop the heart disease too. Even in women, most common reason for death is heart disease. So what are the non-cardiac chest pains? So if somebody takes a deep breath, if it looks like every time I take a deep breath, I get the pain. Usually that's not cardiac. It's the positional. If I go to the right side, it happens. Left side, it doesn't happen. Sharp in nature. Or if I can make the pain happen, if there's a pain and I press on the chest wall, and if it happens, it's usually not a cardiac pain. And it's a non-exertional. If it's happening more, not doing the activity, but it happens randomly, but when you exercise, it doesn't happen. Usually these are more goes with the non-cardiac chest pains. So what are the risk factors? So there are some risk factors which you cannot control. Age, we are all going to get older. As we get older, we're going to get the heart disease. Gender, I said males are a little bit earlier get the heart disease. And if you have a family history, this is one of the risk factors I would really, really want you to look into. If you have a family history of the heart disease, if somebody in your family had a blockage in their 40s, 50s, 60s, please be aware that your risk of a heart disease or blockages is a lot higher than somebody who doesn't have a family history. So always, if you have a family history, get it checked. You're 40, 45, 50, somewhere around 40, I think you should have it checked if there is a family history in the close family, parents, brothers, sisters, grandparents, any of your close family members, uncles, aunts. If they have a heart disease at a young age, you should be more careful. So what are the controllable risk factors? These are the controllable risk factors. Hypertension, which is a high blood pressure. If the blood pressure is consistently running 140 over 90 or more, or somebody has a diabetes. So according to American Heart Association, 65% of the diabetic patients have some part of the heart disease. So we treat somebody with a diabetes as aggressively as somebody who has a heart disease. because invariably, more majority of the diabetics develop the heart disease. So you need to be more aggressive when you have diabetes compared with when somebody doesn't have diabetes. And then high cholesterol, obesity, unhealthy diet, smoking, lack of physical activity, and a lot of stress. These are some of the risk factors which we can control to most of it. I think we need to control as much as we can control these kind of risk factors. These are all additive. So if you have a diabetes plus hypertension, your risk is a lot higher than somebody who only has diabetes. But somebody has diabetes, hypertension, high cholesterol, their risk is a lot higher. So these are one of the studies showed, these are like 9 risk factors looking at 52 countries, population, 27,000 people. So who consumes less fruits and vegetables, they have a higher risk. Again, smoking, excessive alcohol consumption. In moderation, it's okay, but excessive alcohol consumption definitely causes the heart muscle to be weak. I think it's bad to be selling this festival time with the Dasara and Diwali going on, a lot of parties on the weekends, but I think excessive is what I'm talking about. I think in moderation is good. Psychosocial factors, high levels of stress, sedentary lifestyle, then same again, abdominal obesity. These are all the risk factors which we can control. So few things about what we can do to find out if there is a blockage. So it's stress test. Stress test is where we make people walk on a treadmill to see if their heart is getting good blood flow or not. Sometimes if somebody cannot walk, we can do pharmacological stress test where we can inject the medication and make them feel like they're exercising so that we can see if there is blockages. These are tests to find out if the blockage is more than 70%. These stress tests is not for a heart attack. It does not show what your heart attack risk is. It just tells you if there is a blockage of 70% or more there or not. If somebody is having a chest pain, if I do a stress test, that test test is positive, means most likely that chest pain symptom is coming from the blockage. But it does not tell us what is the risk of the heart attack now or for the future. So when you do the exam and talk to the patients and we do an EKG, we get a lot of the information so that that can guide us what we need to do. We need to do a stress test or we need to do an angiogram or something else. But need to remember, no one symptom or a typical symptom that is 100% tells us is a cardiac or non-cardiac. I have patients who told me the chest pain, tightness. I know that 90% there is a blockage, but I also had patients with the same exact history and symptoms, and they don't have any blockages. So there's no one symptom which rules it out or rules it in what the heart disease is or angina is. But the description of the exertional chest pain, pressure-like sensation, that's valuable information. So this is kind of a look at what we do when somebody is low risk, what we do, exercise stress test, different pharmacological stress test. So PET scan, Lexi scan, these are all different kind of stress tests we can do depending on the EKG and depending on what their risk factors are. I'm going to briefly talk about heart failure. Heart failure is a syndrome where heart is not pumping enough blood flow to get the activities going of our organs. Heart failure this is the most common hospital admission, and we spend a lot of money. So we have 5.1 million Americans have the heart failure. So 1 in 2 patients with a heart failure do not make it to 5 years. So mortality, somebody with a heart failure is 10% per year. So why I'm saying about the heart failure is somebody gets a heart attack, they get a heart damage, and they are more prone to develop the heart failure. Once they get the heart failure, the risk of sudden death as well as the risk of death goes a lot higher. So this is an echocardiogram. This is the left ventricle. This is the right ventricle. These are the atria. So this will give us the information about how the heart muscle is working, how the valves are working. This is one of the tests tells us how the heart is pumping. So, a lot of people have this tendency that, I'm going to take one medication, not to take the medication. So this is the treatment for a congestive heart failure. So when somebody has a congestive heart failure, as I said, 10% of the people die every year with a heart failure. But when you take all these medications, look at these medications, each medication, the 2-year mortality, if we don't take anything, 35% of the people don't make it to the 2 years. But if we start taking the medication, the ACE inhibitors or ARBs, that group, just one group decreases by, make it to 27%. Then we add a beta blocker, that goes down to 18%. When we give aldosterone antagonist called aldactone, so it goes down to 13%. By putting a defibrillator pacemaker, the risk goes down to 8.3%. So there's another group called ARNI and Presto, which decreases the risk to 6.9%. So my point is, when doctor tells you to take the medication, I think those additively decreases the risk. So here, this person who could have died, 35% chance of dying in 2 years without any medication, their risk went down to 7% by taking all the medication. So that just to keep it a point that when we are recommending some medications, yeah, there are side effects with the medication, no question about it. But the risk versus the benefit, when we're giving the medication, when the benefit outweighs the risk, that's when we do the medication. So these are the defibrillators. And if somebody who has a heart failure, this is an artificial heart. So this is a pump coming out of this, like basically like our pump where we're doing the blood is sucked out of the heart and then goes through this pump into the aorta. This is an artificial heart, or called LVAD for some people. And some people, the heart muscle gets a lot more damage and we take the heart out and then do another heart called a heart transplantation. So let's switch gears. I'm just going to talk about why the South Asians have such a high rates in heart disease. Why Indians, Pakistanis, Bangladeshis, Nepalis have so much more heart disease. So if you look at the heart disease, if you look at the population of the South Asians, we comprise about 25% of the total population of world. But if you look at the heart disease, South Asians have 60% of the world's heart disease. So that's almost 2 to 3 times more heart disease in the world, just concentrated in South Asians. So they have highest rate of death compared to any other ethnic groups. So more multivessel disease, more left main disease, which is the main artery, and the sudden death is a lot higher at a younger age in South Asians. Almost heart rate, the sudden death risks increased in the last 10 years in India. I think the westernization kind of getting more McDonald's, more KFCs and all these things. And everybody has a car now, not walking as much as we used to do when we were younger. So those westernization kind of made our heart disease risk a lot higher. To begin with, we have a more risk of having the heart disease. And now all this westernization decreased our activity and made our the diet a lot worse. All of them kind of increase. Every month, I hear 1 or 2 people in their 20s and 30s having the heart attacks in India. Even in Hyderabad, especially with Hyderabad being a diabetic capital now, I think there's so much more diabetes in Indians. And with diabetes risk, with all these risk factors changing in a bad way, our risk is getting a lot higher. I think we need to take care of it right now. Otherwise, I think we're going to see a lot of problems in the future. So just in the last 10 years, 13% increase in sudden cardiac death among the 30s to 40s people. So let's see when we need to start looking at these kind of things. If you look at, this is what we call IVUS, is an intravascular ultrasound, where we put a little catheter into the heart artery to look at how much is the plaque within the artery. So if you look at the kids 13 to 19 years of age, already 17% of the kids already have some plaque building up already. So it's not, you don't need to wait for 30 or 40. So as you go higher, so the plaque starts to get more and more. So you need to take care of the risk factor modification as early as 20 or less, even less. So especially if you have a family history. So this is the study looking at Indian men compared to the American men in the Framingham Heart Study, which looked at the risk factors. So in Framingham Heart Study, so the death rate between the ages of the heart study, it's the prevalence of heart disease between 30 to 70 is 2.5%. But if you look at these are the CADI study, which is looking at Indians in different parts of the world and in India. So if you're a vegetarian or non-vegetarian, or you're New Delhi or Chennai or Kerala, your risk of prevalence of the heart disease is 10% to 13% compared to Americans, which is only 2.5%. So it's almost like 4 to 5 times more heart disease prevalence in Indians compared to Americans. This is another study from Europe. It's called Lollipop study, looking at Indians in Europe. It's going to show one. So this is if you look at the Europeans, where the heart disease is as age goes by, the prevalence. So look at Indians in red. So Indian prevalence is almost 30% by the time you get to 75, whereas prevalence in Europeans is only 10%. So it's about 2 to 3% prevalence in heart disease compared to Europeans in this study. So this is interesting kind of a study, the same from Europe. So when they looked at the ages of between 20 to 69 compared to South Asians versus United Kingdom, how many people with heart disease per 1,000 die because of the heart disease? So if you look at the total, if the 100 whites die, so 136 Asians die, South Asians die because of in that age group. But if you look down the different age groups, if a white person or Caucasian between 20 and 29 has a heart disease, 100 people die. In South Asians, 313 people die. So that's the 3 times more sudden death in this age group compared with the Caucasians. In the 30 to 39 age group, if 100 Caucasians die, 210 Indians die or South Asians die. So our risk of not only have the more disease, but our risk of sudden death is a lot higher. So this is the inside of a heart artery. So if you look at the artery, this is where we want. This is it's called endothelium. So this is called epithelium. I think this is the muscle layer. So this, you want the inside of the artery should look like this, but around 15, 20, somewhere around there, you start to form little fatty streaks. Depending on the risk factors, it may happen earlier. So as the time passes, it gets slowly more and more and more. So when it gets to here, this is where people get the blockage related chest pain. So this one we can find out by doing a stress test. But unfortunately, look at these. So there is this plaque is only maybe 20%, 30%, but suddenly this ruptures. This rupture makes the blood clot to happen. Blood clot makes it 100%. That's what the heart attack is. So these 3 are the ones which we cannot predict. So why the plaque rupture happens, we don't know. So there are a lot of theories, a lot of risk factors. Somebody has a lot of stress can have it. A lot of smoking can cause it. The viral infections can cause it. But there is no one reason why the plaque ruptures. I have patients with a lot of plaque, never ruptures. I have patients with 1 plaque, it ruptures. So we don't know why this happens. So this is kind of unpredictable. So the best thing is not to have the plaque, rather than if this happens, we can take care of it. But this is the kind of a thing which we want to more concentrate on so that the plaque rupture doesn't happen. So this is again the heart artery. These are the 3 heart arteries. This is the right coronary artery. This is the LAD. That is the circumflex. So these are the kind of 3 arteries where inside should be like this. You get the plaque, and then it gets plaque more. And this one we can find out with the stress test. But here it's completely 100% blocked. That's what a heart attack is. So when the heart attack happens, this artery closes down, and this causes the damage to this heart muscle area, which causes the pain, which causes the damage to the heart muscle. So this is an angiography of a person. So this is how artery should be. The artery is clean. These 2 arteries are clean, and there's another artery on that side. But if you look in this is completely 100% blocked here. So this is the heart attack. When the heart attack happens, one of the heart arteries is 100% blocked. This is when we can go through here, put a balloon in and open it up, and that we make it like the completely open artery, and that relieves the pain. So going back to the South Asians and why we have so much more heart disease, our increased obesity, especially central obesity, so abdominal fat. So that will give us more risk of having the blockages. Insulin resistance, as I said, India is becoming a diabetic capital, especially South India. So I think those are insulin resistance is one of the main reasons why our heart disease is getting more and more prevalent in Indian population, among others. So fruits are good, but we don't want to look like one. So either this or this, both can cause more increased metabolic syndrome risk, and that will increase our risk of having the heart disease. So these are some of the risk factors which are kind of proposed to be the reasons why we have a lot more of the heart disease, but there's not that much we can do about all these except exercise, eating right, and the risk factor modification. So this is the stress test, how we walk on a treadmill or do the bike, and so that we can see what's going on. And this is the one important slide, coronary calcium score. You hear about the coronary calcium score significantly increasing. Whenever there is a plaque becomes calcified. So this is the aorta. So the artery should look like this. All this white stuff is the calcium. Whenever there is a calcium, there is a plaque, 100%. When we see the plaque in the heart artery with the calcification, that means that that person 100% has a blockage in the heart artery. It doesn't tell us whether it's a 20% or 90%. It just tells us that there is a plaque. So this test is not for somebody who already had a stent or already had a bypass. This test called coronary calcium score, which is a $100 test in the United States, which will tell us how the plaque is building up in the heart arteries. This is all the white stuff. Once you have a plaque, so risk of the plaque rupture can go higher. So I would like to request all of you, if there is a family history, talk to your family doctor, talk to your cardiologist. If you don't have a history, but you do have a family history, if you have never had a blockages, get this $100 test that will tell you exactly whether there's a plaque is there or not. Not having a plaque does not rule out the plaque, because the plaque forms as a soft plaque. But once you have a plaque, this definitely has a plaque. And this is another test called CT angiography, where we can inject the contrast into the vein, and that can see there is a blockage here in this right coronary artery. So you want the artery to be clean like this. There's another little bit of plaque there. So this is another way of looking at the heart arteries, but this will tell us how much the blockage is. And the other one is the angiogram. This is for people who have a high risk of finding out a blockage, or if you're having the symptoms, then we do the angiogram. So what are the goals for the cholesterol? So the bad cholesterol, you want it to be less than 100 for most people. But for Indians, I prefer to keep it under 70. So, and the HDL, the good cholesterol, this is one of our problem. HDL is mostly only low 30s most of the time for Asians. So I think that exercise. That's the only thing which will make your HDL to go higher. And you want the triglycerides to be less than 150. So regular physical activity, avoidance of smoking, weight maintenance, low-fat diet, and then keep the cholesterol down. So we worry about the financial health more so than all other healths. So we need to take care of our physical health, mental health, spiritual health, social health, and the financial health should be the last one. But the other ones are more important than the financial health. So one of my cardiologist friend tells this, I think it looks good. Wake up to identify, be aware of the risk factors. Shake up, exercise regularly, have regular checkups, and the switch diet to follow low-fat diet. Sacrifice the salt, sugar, and quit tobacco. Serve the community and socialize. These will decrease your risk of the heart attack by doing above measures. So this is one of the slides comparing the US to the Indians, what we need to do more than others. So if regular physical activity, if regular walking 150 minutes per week for the US population, we should be doing at least 300 minutes. BMI, our BMI should be less than 23, not 25 like a regular recommendation. So ideal blood sugar is the same. The LDL, as I said, I think lower the better. So let's talk about this myths I initially brought it up. So normal stress test means no risk of heart attack or a cardiac risk or sudden death. So stress test only shows if the blockage is more than 70%. So that too only in about 70 to 85%, depending on what kind of stress test we are doing. So it's not, normal stress test does not mean that there's no blockage. And then I see all the time somebody saying, I have to eat good diet and exercising regularly, I'm not going to have a risk of heart attack. It decreases the risk for sure, but it doesn't eliminate. So you still need to have the regular checkups. So if there is a problem, take care of it. I don't have symptoms, so I don't have any blockages. Not true. Symptoms only occur when the blockage is almost 80 to 90%. Okay? Most people don't get the symptoms. Just because there's no blockage does not mean that there's no symptoms. So my angiogram showed only 30 to 40% blockage. My risk of heart attack is 0. Not true. More than 50% of the time, blockages which cause a heart attack are caused by the blockages less than 50%. So that's the plaque rupture. So my calcium score is high. My risk of heart attack is very high. Not true. Its risk is increased, but not very high. I have patients with a calcium score of 3,000, 4,000, 5,000, never had a heart attack, no symptoms. I've been following them for 10 years, never had a heart attack or the blockage did not get to. But I also have patients with a calcium score of 1. Literally 2 weeks ago, I had a patient with a calcium score of 1.5. He had a 90% blockage. So calcium score doesn't give us what the blockage percentage is. It just tells you that there is a blockage. The stents and bypass surgery improve the survival. Not true. Most of the time, stents and bypasses only improve the symptoms, but does not improve the survival. Few exceptions are somebody having a heart attack, definitely that improves the survival by putting a stent in, but majority of the time, medications do work as good as the stents and bypasses. So this is one of the last slides. Please take care of yourself and avoid injuries, because spare parts for old models are no longer in stock. As most of us are made in 40s, 50s, 60s, and 70s models, warranty period is long over. Expiry date is due soon. Caution better. Keep reminding yourself that we are limited edition. We got to take care of ourselves. Avoid heart disease by following a healthy lifestyle. Thank you. I will leave it to, I think, Arya and Sharda Garu to see if they have any questions so that we can answer the questions.
Thank you very much, Dr. Srini. That was really helpful. I just wanted to mention one thing that about eGlobal Doctors. If you are Indian origin living in US and if your parents are visiting from India, you do not need to worry about their medical needs in US. eGlobal Doctors has your back. We have different packages for you starting from $199 that provide access to 300 plus doctors from US and India with 30 plus specialties, and you can avail these without any insurance. So if the subscribed package is not used within 6 months, don't worry, subscription can be extended to 1 year. So be rest assured that your health is in very safe hands. And also, if you're looking for diabetes reversal or reversal of PCOS or thyroidism, so you can find nutritional coaches, expert nutritional coaches. We offer different diet programs. One is the free diet assessment, the 3 weeks program, and also the 3 months program with dedicated coaches. So we have a short offer that if you register with us at www.eglobaldoctors.com today, you might get a free primary consultation from us. Thank you.
Thank you, Arya. I think from an eGlobal Doctors point of view, I think I know eGlobal has done a good job during the COVID pandemic. And it's easy to get a doctor, whether they're from India or US or UK. You can connect with the doctor who you want to connect with. I think the one other thing is, especially if the family is visiting or the parents are in India and the doctors are here, we can connect at the same time on the Zoom so that we'll get that mental peace when you're talking to the doctor at the same time with the patients are on the Zoom call. So similarly, so if I have a patient I'm seeing from Hyderabad, or if my family member is in Hyderabad needs a doctor, I cannot talk to the doctor until the consultation is over. And then the doctors are so busy and you can't get hold of them and you don't know what your loved one has. So with the telehealth consultation, all will be on the same page and same time. We can review the records. We can go through the information, and you patient as well as the family can be on the Zoom call at the same time so that we can answer the calls at the same time.
It is now possible to have the most experienced, highly qualified and compassionate doctors at the click of a button. eGlobal Doctors is a user-friendly, secure mobile and web application through which you can have affordable online healthcare consultation and speak to the doctors from the comfort of your own home. You can now avoid traveling long distances to reach the doctor and avoid long wait times. You can now do a video call to eGlobal Doctors physician with the ability of family members to join from different parts of the world. Every user of the platform can have Health Passport, a personalized and secure hub for all of an individual's electronic health records, which includes prescriptions, doctor's reports, and lab reports, with ability to access from anywhere in the world. eGlobal Doctors' second medical opinion is performed by our board-certified and senior doctors, bringing you the world's latest and best health care. We can help patients to get the necessary treatment done at a place closer to them by leveraging our network of doctors who share our vision and values. eGlobal Doctors addresses an individual's medical, surgical, pharmaceutical, and ancillary healthcare needs on one platform at the fraction of the current cost. eGlobal Doctors is one complete healthcare platform solution for all your medical-related issues and questions. Our goal is to provide unbiased and honest medical opinion. We are available 24/7. Please visit us at eGlobalDoctors.com.
థ్యాంక్ యూ డాక్టర్ శ్రీని గంధసాని గారు. చాలా క్లియర్ గా ఎక్స్ప్లెయిన్ చేశారు. అసలు మా ప్రేక్షకులకి అడగడానికి ప్రశ్నలు లేకుండా ప్రతి రిస్క్ ఫ్యాక్టర్ ని చాలా బాగా చెప్పారు. సో ముందుగా ఈ గ్లోబల్ గ్రూప్ ద్వారా అంటే సభ్యత్వం తీసుకున్న వారు ఎలాంటి లాభాలు పొందగలరో ఒకసారి ఎక్స్ప్లెయిన్ చేయగలరు.
సో ఈ గ్లోబల్ డాక్టర్స్ ద్వారా టూ డిఫరెంట్, మన ఇన్సూరెన్స్ లేకుండా అమెరికాకు వచ్చి మన పేరెంట్స్ కానీ ఫ్యామిలీ మెంబర్స్ కానీ వాళ్ళకు ఎనీ హెల్త్ కండిషన్ ఉంది, డయాబెటీస్ కానీ హైపర్ టెన్షన్ కానీ హార్ట్ డిజీజ్ ఉంది, ఒక సెకండ్ ఒపీనియన్ కావాలి, మన మెడిసిన్స్ కరెక్ట్ ఉన్నాయా లేవా తెలుసుకోవాలంటే, సో యూ కెన్ గో టు ద ఈ గ్లోబల్ డాక్టర్స్ అండ్ రిజిస్టర్ అండ్ వీ కెన్ హ్యావ్ ఎ లోకల్ డాక్టర్ హియర్ ఆర్ యూ వాంట్ ఫ్రమ్ యూకే ఆర్ ఆస్ట్రేలియా ఆర్ న్యూజిలాండ్ ఆర్ ఇండియా. మీరు పిక్ చేసుకోవచ్చు నాకు ఎటువంటి డాక్టర్ కావాలా, ఏ లాంగ్వేజ్ మాట్లాడే డాక్టర్ కావాలా. అట్లా ఇప్పుడు నేను తెలుగు వాళ్ళు మాట్లాడే వాళ్ళు ఉంటే వాళ్ళకి ఈజీ, నేను మాట్లాడితే తెలుగులో మాట్లాడితే వాళ్ళకి బాగుంటుంది, నాకు బాగుంటుంది. సో అట్లా పేషెంట్స్కు సరే కరెక్ట్గా ఏ లాంగ్వేజ్లో ఉంటారో దే కెన్ జస్ట్ టాక్ టు దట్ కైండ్ ఆఫ్ ఎ డాక్టర్. సో యూ కెన్ పిక్ అండ్ చూస్ విచ్ కైండ్ ఆఫ్ ఎ డాక్టర్ యూ వాంట్, వాట్ స్పెషాలిటీ యూ వాంట్, what languages do you speak. So now I think we want to give an opportunity to use the eGlobal doctors to connect with any doctor anywhere. With ATA members right now, since the convention for this year, we wanted to give 25% discount to all the ATA members who can go to eGlobal Doctors website and put a code ATA 2022 so that they can get a 25% discount. So if the regular consultation is $100, so they will get it for like $75. So that will be one thing. And even the people who have a doctors, they've seen the cardiologist, but they have a second opinion, or they want to have an oncology second opinion. They just want risk factors, talk to them. And we have a great dietary program. You can get like 2 or 3 free consultations for the dietitian because diabetes is so high and there is no clear-cut idea for American dietitians where an American patient, our Indian patient goes to American dietitian, it's so difficult because they cannot explain our food. They don't know our food. Whereas by going through dietitian on eGlobal Doctors, so you can talk to the dietitian from Indian origin so that they can explain what to eat, what not to eat. And if you're interested, you can continue with the dietary plan, the nutrition plan and the dietitian plan, or otherwise you can stop it and then you can go on and do by yourself. I think ultimately the goal is to get all the people access from your own home and talk to the doctor what you want. That is and then the second thing, we also have a multi-specialty consultation. What that means is for a cardiologist, for example, somebody has a blockages, but also has an electrical problem, defibrillator. Through the eGlobal multi-specialty consultation, you can see the 2 doctors, 3 doctors can be same time talking to the patient and their family at the same time. So that's instead of going to this doctor, another appointment, that just saves the time and you can do it from your home. And all our doctors are combining together what they want at the same time.
థ్యాంక్ యూ డాక్టర్ శ్రీని గంధసాని గారు. వైద్యో నారాయణ హరి అంటారు. నిజంగా మీరు దేవుళ్ళకి మారుపేరని మేమందరం అనుకుంటూ ఉంటాము. థ్యాంక్ యూ సో మచ్ ఫర్ యువర్ టైమ్ టుడే ఫర్ ఆటా అండ్ డూయింగ్ దిస్ వెబినార్ త్రూ ఆటా. మీకు కొన్ని క్వశ్చన్స్ ఉన్నాయి, ప్రేక్షకులు అడిగారు. శ్రీకాంత్ కే గారు అడుగుతున్నారు, వాట్ ప్రికాషనరీ టెస్ట్ యూ సజెస్ట్ ఫర్ 40-year-old?
సో 40-year-old male, I think ఒక స్ట్రెస్ టెస్ట్, సిమ్టమ్స్ ఉంటే స్ట్రెస్ టెస్ట్, సిమ్టమ్స్ లేకపోతే రెగ్యులర్ బ్లడ్ టెస్ట్. మన కొలెస్ట్రాల్ ఎంత ఉంది, బ్లడ్ ప్రెషర్ ఎంత ఉంది, షుగర్ ఎంత ఉంది, షుగర్ పెరుగుతుందా లేదా. బికాజ్ బ్లడ్ ప్రెషర్ కానీ కొలెస్ట్రాల్ కానీ ఈవెన్ షుగర్స్ కానీ ఇనీషియల్గా సిమ్టమ్స్ ఏమి ఉండవు, బట్ డ్యామేజ్ ఇస్ బీయింగ్ డన్ in our body to the heart, to the brain, to the kidneys, to the arteries in the neck, the carotid. So damage is being done irrespective of whether you're feeling it or not feeling it. So going to the doctor on a regular basis and then checking it, and then the coronary calcium score is a good test for $100. That gives a lot of information. So a lot of times if you don't know, you assume that, oh, I don't have any blockages, I can go on and do whatever I want to do. By doing the calcium score kind of a testing, what you're doing is you're finding out early on. So you can take care of your risk factors a lot more aggressively and take a baby aspirin, and you can take a cholesterol medication if the cholesterol is high, so that you can be a better, healthy person by taking care of it at the 40 rather than waiting for something to happen. I'll tell you this, some Indian philosophy from the beginning. Even I remember when I was young, growing up in a small taluk in Mahbub Nagar. So we didn't have that many doctors. So we never used to go to the doctor unless you have a problem. You get fever, you go to the doctor. But in America, the philosophy is different. You want to be proactive. You don't want to be reactive. I think we are still on the mentality of the reactive mentality where if there is a problem, I'll go. Otherwise, I'm okay. That is, I don't think is a good concept. I think we need to be proactive, taking care of our health. When you're like 25, get your cholesterol done so that we know if the cholesterol is high, you can take care of it over the time. But you don't want to wait for something to happen and take care of it. So I think the main thing I would say is that get the blood work done, the stress test done. If you have any symptoms, at least calcium score done. If the calcium score is elevated, then you can get the stress test done, even if you don't have the symptoms.
Thank you, Dr. Garu. I think Srikanth Garu, మీ క్వశ్చన్ కి ఆన్సర్ కరెక్ట్ గా చాలా అంటే పరిపూర్ణంగా చెప్పారని భావిస్తున్నాను డాక్టర్ గారు. అలాగే ఇలాంటి ప్రశ్నని రాజశేఖర్ అన్నుల గారు కూడా అడుగుతున్నారు. ఎనీ ప్రోయాక్టివ్ టెస్ట్ దట్ వన్ కెన్ గెట్ ఇట్ డన్?
అదే కాల్షియం స్కోర్ అనేది ఒకటి, ల్యాబ్ వర్క్ అనేది సేమ్ థింగ్. స్ట్రెస్ టెస్ట్ ఇస్ మోర్ ఫర్ సింప్టమాటిక్ పేషెంట్స్. బట్ యాజ్ ఐ సెడ్, డయాబెటీస్ ఉంటే కానీ, బ్లడ్ ప్రెషర్ ఉంటే కానీ, కొద్దిమందికి లాంగ్ స్టాండింగ్ ఉంటే సిమ్టమ్స్ రాకపోవచ్చు. కొన్నిసార్లు మనం ఏం చేస్తామంటే, సో వెన్ వీ గెట్ ద సిమ్టమ్స్, వీ కైండ్ ఆఫ్ ట్రై టు లిమిట్ అవర్ యాక్టివిటీ. If I know that if I go 3 flights of stairs, if I get shortness of breath or chest pain, what I do, I take the elevator if I go to 3 flights of stairs. And if I go 1 or 2 flights, I can go take the stairs. So we limit our activity. When you do the stress test, we are pushing ourselves to the extent that if there is a problem, we can find out earlier. So 70% blockage tarvata, you start to get the symptoms. Until the 70%, you're not going to find out. So that's where the calcium score comes into the picture. But after 70%, if you're very active, if you're a marathon runner, you can get the symptoms when you're at 70-75%. But if you're at the couch potato, so you may not get the symptoms until you're like 95%. So, and sometimes we also get the bypasses develop in our own arteries. So you may not get the symptoms until late. So I think by doing the stress test and then doing the calcium score and then just doing the risk factor modification and then doing the blood work, I think that will take care of majority of the problem. But if you get the symptoms, don't wait too long, especially if you get the chest pain, shortness of breath, sweaty, nausea, go to the hospital and check it out.
థ్యాంక్ యూ డాక్టర్ గారు. అలాగే విలాస్ రెడ్డి గారు అడుగుతున్నారు, $100 ఫీజ్ ఇస్ ఓకే, హౌ టు టేక్ అపాయింట్మెంట్ ఫర్ దిస్ పర్టికులర్ టెస్ట్?
కాల్షియం స్కోర్ అయితే ప్రైమరీ కేర్ డాక్టర్ దగ్గరికి వెళ్తే, మీరు మీ ఫ్యామిలీ మెడిసిన్ డాక్టర్ కానీ ఇంటర్నల్ మెడిసిన్ డాక్టర్ దగ్గరికి వెళ్తే వాళ్ళకు కాల్షియం స్కోర్, దే కెన్ ఆర్డర్ ద కాల్షియం స్కోర్. Some people don't feel comfortable. Sometimes they may send you to the cardiologist to do it. But majority of at least in in Atlanta, all my primary care doctors, they do calcium score by themselves. And once they do the calcium score, if it's elevated, they send the patient to me so that I can do the stress test if there is a problem there or not. So the calcium score, most of the time, you can ask your primary care doctor, or internal medicine doctor. In Atlanta, there are a lot of outside clinics. None of the insurances cover the calcium score, but it's only $100, and some of them do it for $25. So anywhere from $25 to $99 is the majority of the CTs have the calcium score, which is a CT scan. So CT scan of the chest for the heart. So it's called virtual scan, which is called coronary calcium score. But most of the time, people know, the doctors know if you say the coronary calcium score.
థ్యాంక్ యూ. అలాగే ఇంకొక వ్యక్తి అడుగుతున్నారు, వాట్ ఈస్ ద టెస్ట్ నేమ్ ఫర్ $100 and also does CT angiogram show any risks?
So calcium score dwara is a CT scan. So risk is very minimal. There is always some kuddiga radiation risk untadi, but the radiation risk is so minimal, the benefit you're going to get outweigh that minimal risk of radiation. So that's one. The CT angiogram is the second kind of a test where we inject the contrast. It's a little bit more risk because the contrast is going into the veins and going to all over body. It can cause a little bit of a damage to the kidneys, especially if your kidneys are not working. So for that kind of a test, you need to check the kidney function, make sure that the kidney function is okay. And then we do the angiogram where we inject. But that is a test where you can see the blockages. So we know whether it's a 20% or 80% or 90% without doing the regular angiogram where we have to go to the cath lab. So the risk is minimal. That always there's going to be risk. So the way I look at it is, driving on highway is a risky, but we are still going because there is you can't just stay home all the time. But the risk is so minimal, the benefit is so much more. So I think you'll be better off doing these tests or taking the medications. So if the risk is higher than the benefit, I don't give that medicine. I don't do that test.
అలాగే పార్థసారథి గారు మరి ఒక ప్రశ్న అడుగుతున్నారు. కెన్ వి గెట్ లిస్ట్ ఆఫ్ ఆల్ టెస్ట్ రిక్వైర్డ్ ఇన్ వన్ ప్లేస్?
మళ్ళీ ఒకసారి చెప్పండి.
కెన్ వి గెట్ లిస్ట్ ఆఫ్ ఆల్ టెస్ట్ రిక్వైర్డ్ ఇన్ వన్ ప్లేస్? ఆల్ టెస్ట్ రిక్వైర్డ్ ఇన్ వన్ ప్లేస్, యా.
సో అదైతే ఒకటేమో సిటీ స్కాన్, ఒకటేమో బ్లడ్ వర్క్, ఒకటేమో యాంజియోగ్రఫీ, ఒకటేమో లైక్ డిఫరెంట్ కైండ్ ఆఫ్ స్ట్రెస్ టెస్ట్. సో ఒక విజిట్కి వెళ్ళినప్పుడు అన్ని టెస్టులు చేయించుకోవచ్చు, depending on the facility. If you go to a bigger place, you can do all at one time. And some of the hospitals may not have it if you live. But I think if you go to a cardiologist place, most of the time we can do the tests the same time. But some of them you need to make the appointments. Nowadays I think because with the COVID, we are like in so much more difficult to get the appointments in time. So in our office, we used to get the stress test and echo done within like 2-3 days. Now it's taking almost 1 to 2 weeks to make the appointments because there is so many more patients are coming in with the symptoms.
అలాగే చివరిగా ప్రవీణ్ బిల్ల గారు చెప్తున్నారు, థ్యాంక్ యూ డాక్టర్ శ్రీని గంగసాని గారు, వెరీ ఇన్ఫర్మేటివ్ అండ్ హెల్ప్ఫుల్ presentation. Thanks for sharing.
Thank you for the opportunity. I think be healthy, take care of yourself. I think my goal is to have everybody be healthy. I would rather you guys to be home taking care of your family, taking care of yourself, rather than going to the doctor and taking care of your problem in the hospital. So be healthy, so be safe. I think that's what I think. Risk factor modification is the key, and be proactive, not to be reactive. And if you need help, you can go to your primary care doctor. But if you want to, I think global doctors can help you with the consultations from anywhere in the world with any doctor anywhere. Thank you for this opportunity. Again, ATA team, I think you've done a wonderful job. I think you keep doing a good job.
Sinan, we have a lot more questions. Sharada is going to ask.
Yeah. Alage Madhavi Nomula, great information. Can you send me details of how to do video call with the eGlobal group?
Yeah, they can go to eglobaldoctors.com and then register as a patient. I think then our team will contact and then connect depending on your time and the doctor's time. So that I think this is basically the eGlobal Doctors is a telehealth platform where we can connect the doctors and the patients according to their time, so that you can do the telehealth consultation over the video call.
Anil garu, do we have any more questions that we can see?
Yeah, there are a lot of questions. So Atma Ram, does Medicare support services from eGlobal Doctors?
So right now, there was a question about the Medicare or the insurance. Right now, we are not taking the insurance because it's a little bit of bigger process. So we are doing more for, initially we started this for people, families visiting from India, or parents visiting from India. Visitors insurance never covers anything, even though we have the visitors insurance most of the time. It only covers the emergencies. So this is more for providing them with what they need when they are visiting. If you have a diabetes, medications running out, or if there is a hypertension is going higher, to take care of it. And also for the secondary consultations from India or UK, if they want to get a second opinion about what I would do in America. Because as a cardiologist, believe it or not, I get WhatsApp consults every day, at least on a daily basis, most of the time, at least 3 or 4 per week. So somebody's asking me what to do, what not to do. So I don't mind giving the answers on WhatsApp, but these are only my friends or friends asking me the questions. But there are a lot of people who may or may not know a doctor who can directly go and contact them and talk to them about a second opinion or what if they're doing it right or wrong. So I think that's where the eGlobal Doctors kind of a thing helps for somebody who doesn't know any doctor in the family or friends. For $100 or $150, you can get an opinion by putting all the information into the eGlobal Doctors website, where your form will be there. And one advantage of eGlobal Doctors is I can take my chart anywhere. So if I download all my labs and my consultations, I can be in here in Atlanta, or I may go to India. All my labs are in my phone. So the chart is on my phone. My CT scan, if I had one, it's in the chart. So if I had go to the doctor in Hyderabad or Delhi, I can just show them, hey, this is my consultation. this is my history, everything what you need is in one. So that is your health chart. Basically, you're carrying your health chart with you wherever you go in the phone. We may not have our spouse with us all the time, but our phone is there all the time. So I think having a health information with you all the time, that's a great kind of a benefit.
Dr. Srini garu, this is a follow-up question to Miss Nomula gar question, and you answered that we can go and register on eGlobal Doctor as a patient. So in this scenario, should Miss Nomula register as a patient, or she should register the intended parent as a patient?
So that's a good question, Gautam. I think so. This is for the patient. So we have a family kind of a thing. So one person, because our parents may or may not have the emails and stuff. So we have you can go register for your parent. So you basically whoever the patient is, they register. So they are the patients. But I think you have access to them through your email, and you can come in on the Zoom call with your parents as long as they have a permission from the patient.
Okay. So let's say she registers for one patient and takes an annual subscription, and within 1 year, another parent, she needs advice for another patient, another parent. So would the same subscription work for another parent, or does she need to do a new registration for another parent?
So right now, the way it works is it's each patient related package. So if there's one patient, so the package is for that person, not a family package. So I think if you don't want to get the family package, it's okay to just go individually. So if I have a problem, I can go get a consultation. So you can go do the consultation as it goes by. So packages will be beneficial because it's a cost effective. But if you don't want to take a package, you can go anytime and then register and ask for a consultation. So that will be $99 for a consultation from a family medicine or internal medicine doctors.
Okay. Thank you, Dr. Srini.
Thank you, Dr. Garu. And Atmaram garu gurinchi inka konni couple of questions unnai. Vari next question vachi, can residents in India pay in rupees for services from eGlobal Doctors?
So yeah, in India lo kuda doctors unnaru eGlobal ku. So the advantage is if you want to get a eGlobal Doctor India consultation, that'll be like 1,000 rupees you can get the consultation, or 750 rupees you can get the consultation. But if you want an American doctor, they'll be like American. You can get the consultation. So the eGlobal Doctors, the concept is we want to connect the patient and doctor anywhere in the world. If a person in Australia want to talk to the American doctor, they should be able to talk. In the same way, if a patient in US want to go back to India and want to get their knee surgery done, they can come to eGlobal and we can connect them with wherever they want to go. If they want to go to Hyderabad and get a knee surgery done, absolutely. So we can get those connections made so that the eGlobal doctors from India will take care of the patients in US or vice versa. So if an Indian patient in Hyderabad or Delhi want to see an American doctor, they don't need to come to America to do a consultation. So I can tell the same thing what I do for a patient in Atlanta for the same patient in India. So they can connect with whoever they want, and they can pick and choose which kind of doctor they want and which country they want, and the consultation fees depending on what their local consultation is according to this country.
Thank you. One more question from Atmaram garu. Does Medicare Part B cover the cost of coronary calcium score test?
At present, none of the insurances cover the coronary calcium score because it's a preventative kind of a test. But the new guidelines are changing. So in Europe, they recently approved the CT angio as one of the testing for the identification of the blockages. I'm hoping that in the next 1 to 2 years, Medicare and all other commercial insurances would start to cover it. But as of right now, none of the insurances cover the coronary calcium score. So that's the reason why they made it cheaper for $100. So if the same CT I order for a CT of the chest, the hospital charges $800. But because the insurance is not covering it, they do it for $100. And the one thing I'll tell you about the calcium score, I found lung cancers. I found the aneurysms of the aorta, because you're not just looking at the heart, you're looking at the whole chest. So you get a lot more information, not only about the heart, but anything in the chest. You have a hiatal hernia, we can see. If there is a lung nodule, we can see. If there is aortic aneurysm, we can see. So for $99, you can get it done. I do my calcium score every 5 years. But once you have a positive calcium score, you don't need to repeat it again and again, because once you have a positive calcium score, you already have a plan. So you don't need to repeat it. If it is 0, do it every 5 years. If it is not 0, if it's already more than 0, then there's no point in doing it again, because calcium score of 20 or 2000 doesn't matter to me. It's the same. I treat the same. So you don't need to do the calcium score if it is more than 0. But if it's 0, do it after 5 years, so that if something changed, we can see. But we can get a lot of other information on the CT scan when we do for a calcium score.
And one more question. Is the presentation available on YouTube for those who want to view later from Atma Rambabu? So I am checking Arta. Okay, go ahead and answer. Anil. You want to?
Yes. This total session is there in the YouTube and Facebook. They can view anytime, lifetime.
Thank you, Anil Garu. And also, Atmaram Garu is asking, is the speaker open to doing Zoom-based webinar for other retiree senior groups?
I mean, I can do it. I'm also I'm doing a lot of other stuff. I'm on the CME chair for API. I'm also on the medical board for Georgia. But I think if I have the time, I'll be happy to help. I don't mind. I like doing these sessions locally. But if somebody wants, I think my email is gangasanimd@gmail.com. So Gangasani, GANGASANIMD@gmail.com. So they can send me an email. If I can get the time, I should be able to do it. Happy to help.
Thank you so much for your time and very good explanation, Dr. Garu. And New Berlin United Volleyball team is saying, good session. Thanks to you, Dr. Garu. And alage Pankaj Sutaria is saying, great presentation, Dr. Srini. Hope a lot of people are enjoying this session. I think that's all right. Anil Garu, is there any more questions?
There is a question from Sunil G. How can doctors be part of eGlobal Doctors team if they want to do service?
Yeah, that's a good question. I think we are always looking for good doctors to be part of the eGlobal Doctors team. So when you go to eglobalDoctors.com, so we have a doctor's registration. So malpractice is covered by the eGlobal Doctors, and then so you can just join the team. So we'll just have a few requisites. I think we look at, just make sure that I have a license, and we connect to people who are only licensed in that state. So the Georgia law is, like any state law is, I can only see the patients in Georgia if I have a license in Georgia. So when these people come in, the eGlobal has a system where we connect with the patients with the state where they have a license in. Now, India is different, but in the US, that's what we do. So if you're interested to be part of charitable work, you can do it. If you want to do the commercial work, you can do it. We also have a charitable arm. We had a few times we do a specific time period that patients can come in and do the free consultations. So we will be doing a lot more of the charitable work too. So it's both. I think there are some doctors in our group only want to do the charity, and some want to do both charity as a commercial work. So whoever want to do be part of the eGlobal Doctors, I think I can go to the eglobalDoctors.com and register as a doctor. Then they can be able to help.
Yeah. And one more question we have, is this service only for Indian parents, or is it also for Indians living and working here? Hello?
I think Dr.
It's for anybody. It's anybody, not only. Okay, now it's back. So Anil, this service is for anybody in the world. So we have patients from Africa connecting, from Nigeria, they're connecting to get a consultation from doctors from US and UK. So this is basically connecting any patient from anywhere in the world to any patient, any doctor anywhere in the world. So that is the goal eventually. So we are about in 6 countries, 7 countries now. We are expanding slowly. So eventually the goal is to get people from anywhere, talk to any doctor in the world.
Okay. All right. I think pretty much that's all. And there are a lot of people thanking Dr. Srini Garu for this important and informative session. The Wisconsin group, as well as there's a Sunil G and Madhavi Nomala. lot of people saying thanks for Srini Gangasani and Ata to provide this informative session. Over to you, Sharda garu.
యా ముఖ్యంగా ఈరోజు ఇంత చక్కటి సెషన్ చేసినందుకు గెస్ట్ స్పీకర్ గా వచ్చి ఇంత వాల్యుయబుల్ ఇన్ఫర్మేషన్ అంటే సేవింగ్ లైఫ్స్ ఈ ఇన్ఫర్మేషన్ మనతో పంచుకున్నందుకు డాక్టర్ శ్రీని గంగసాని గారికి శిరస్సు వంచి నమస్కరిస్తూ ఆటా తరపున మరి ఒక్కసారి హృదయపూర్వక కృతజ్ఞతలు తెలియజేసుకుంటున్నాను. ఈ రోజు చూసినటువంటి ఈ ప్రోగ్రాం వీక్షిస్తున్నటువంటి ప్రేక్షకులందరికీ మరి ఒకసారి ఆటా ధన్యవాదాలు తెలియజేస్తుంది. ప్రజాక్షేమమే ఆటాక్షేమం. అందరూ క్షేమంగా ఉండి ఆరోగ్యంగా ఉండాలనేదే ఆట ఆకాంక్ష కూడా. సో ఈ అందరు హెల్తీగా ఉండాలని ఆట చాలా హెల్త్ క్యాంప్స్ చేస్తూ ఉంటుంది. అలాగే ఇక్కడే కాదు, మన మాతృభూమిలో కూడా ఎవ్రీ 2 years ఒకసారి డిసెంబర్లో కూడా చాలా హెల్త్ క్యాంప్స్ నిర్వహిస్తుంది. అలాగే ఇక్కడ కూడా మ్యారథాన్ లైక్ 5K రన్, అది కాకుండా ఇక్కడ హెల్త్ క్యాంప్స్ ఇవన్నీ కాకుండా 2 years నుండి రెగ్యులర్ గా ఎవ్రీ వీకెండ్ యోగా సెషన్ చేస్తూ ఉంది. తెలుసు యోగా ఈజీ మెథడ్ అండ్ యోగా ఆరోగ్యానికి అండ్ మానసికంగా కూడా ఎంత చక్కటి ప్రోగ్రామ్ మీకు అందరికీ తెలుసు. ఇలాంటి ఆటా చేస్తున్నటువంటి ప్రోగ్రామ్స్ ఎప్పుడు ఆటా ఫేస్బుక్ లో అలాగే ఆటా వెబ్సైట్ లో అవైలబుల్ ఉంటాయి. దయచేసి అందరూ ఆటా ప్రోగ్రామ్స్ ని చూసి ఆటాలో పాలు పంచుకోవాల్సిందిగా కోరుతున్నాను. మరి ఇలాంటి ప్రోగ్రామ్స్ ఏమున్నా కూడా మీకు ఈమెయిల్ ద్వారా తెలియబడతాయి. తెలియాలంటే మీరు మెంబర్స్ గా సభ్యత్వం తీసుకోవాలి. ఆటా సభ్యత్వం తీసుకోవాలంటే సభ్యత్వం గురించిన వివరాలు అన్ని ఆటా వెబ్సైట్ లో పొందుపరిచి ఉన్నాయి. అమెరికన్ తెలుగు అసోసియేషన్.org చూడవలసిందిగా అందరికి ప్రేక్షకులందరికీ మరి ఒకసారి మనవి చేస్తూ, ఈ రోజు వచ్చినటువంటి మన మోడరేటర్ ఆర్య గారికి కూడా ధన్యవాదాలు తెలియజేసుకుంటూ, అలాగే మరి ఒక్కసారి డాక్టర్ శ్రీని గంగసాని గారికి కృతజ్ఞతలు తెలియజేసుకుంటూ, మరి ఇంత చక్కటి ప్రోగ్రాం నిర్వహిస్తున్నటువంటి ఆటా టీం అందరికీ కృతజ్ఞతలు తెలియజేస్తున్నాను. ముందుగా ప్రెసిడెంట్ భువనేష్ భుజాల గారు, అలాగే ప్రెసిడెంట్ ఎలెక్ట్ మధుభూమినేని గారు, ఎగ్జిక్యూటివ్ కమిటీ, బోర్డ్ ఆఫ్ ట్రస్టీస్, ఆటా అడ్వైజర్స్, స్టాండింగ్ కమిటీ చైర్స్, కో-చైర్స్, మెంబర్స్, అలాగే రీజనల్ కోఆర్డినేటర్స్, రీజనల్ డైరెక్టర్స్, రీజనల్ అడ్వైజర్స్, మా సోషల్ మీడియా టీం ముఖ్యంగా నిరంజన్ రెడ్డి, భాను గారు, అలాగే విలాస్ జంబుల గారు, అలాగే శరత్ వేముల గారు, అనిల్ బొద్దిరెడ్డి గారు కూడా, అలాగే ఇలాంటి అంటే మా ప్రోగ్రామ్స్ అన్ని మీరు కనుక చూస్తుంటే దీని వెనకాల ఉన్నటువంటి ఒక స్ట్రాంగ్ మాకు బ్యాక్ సపోర్ట్, మా బ్యాక్ బోన్ ఏబిఆర్ ప్రొడక్షన్స్, ముఖ్యంగా అనిల్ బొద్దిరెడ్డి గారు, వారు మా బోర్డ్ ఆఫ్ ట్రస్టీ కూడా. అలాగే టెక్నికల్ టీమ్ నవీన్ గారు ఎప్పుడు ఈ ప్రోగ్రామ్స్ ఎప్పుడు చేసినా కూడా వారి యొక్క విలువైన సమయాన్ని ఆటాకి కేటాయిస్తున్నందుకు వారికి కూడా ప్రత్యేకంగా ధన్యవాదాలు తెలియజేసుకుంటూ, ఈ ప్రోగ్రామ్ ఆటా యూట్యూబ్ లో అలాగే ఫేస్బుక్ లో ఏబిఆర్ ప్రొడక్షన్స్ ఛానల్లో ఎప్పుడు మీకు శ్రోతలందరికీ ఉంటుంది. ప్రజెంటేషన్ కానీ, డాక్టర్ ఇచ్చినటువంటి విలువైన సలహాలు కానీ, ఏదైనా కూడా మీరు మళ్ళీ చూడొచ్చు. అలాగే వేరే వాళ్ళకు కూడా ఇలాంటి ఇంత చక్కటి ప్రోగ్రామ్ గురించి తెలియచేయచ్చు. మరి అందరికీ చివరిసారిగా ధన్యవాదాలు తెలియజేసుకుంటూ మళ్ళీ వచ్చే ప్రోగ్రామ్ లో మనం అందరం కలుసుకుందాం. ధన్యవాదాలు. సర్వేజన సుఖినో భవంతు.
It is now possible to have the most experienced, highly qualified and compassionate doctors at the click of a button. Global Doctors is a user-friendly, secure mobile and web application through which you can have affordable online healthcare consultation and speak to the doctors from the comfort of your own home. You can now avoid traveling long distances to reach the doctor and avoid long wait times. You can now do a video call to Global Doctors physician with the ability of family members to join from different parts of the world. Every user of the platform can have Health Passport, a personalized and secure hub for all of an individual's electronic health records, which includes prescriptions, doctor's reports, and lab reports, with ability to access from anywhere in the world. Global Doctors' second medical opinion is performed by our board-certified and senior doctors, bringing you the world's latest and best health care. We can help patients to get the necessary treatment done at a place closer to them by leveraging our network of doctors who share our vision and values. Global Doctors addresses an individual's medical, surgical, pharmaceutical, and ancillary healthcare needs on one platform at the fraction of the current cost. Global Doctors is one complete healthcare platform solution for all your medical related issues and questions. Our goal is to provide unbiased and honest medical opinion. We are available 24/7. Please visit us at eglobaldoctors.com.